Hello everyone, my name is Alexis Gonder and I am a first-year MSOT student at Saginaw Valley State University. I am here to present on my occupation-based kit called Art Briefcase that will facilitate bimanual functional task. My patient JW was diagnosed with traumatic brain injury and displays deficits in decreased core stability when performing seated and standing tasks, left side neglect, hemiparesis, spasticity, difficulty with initiating steps, and limited active range of motion in left upper extremity. JW enjoys sketching, playing guitar, playing cards, and going to concerts. The performance deficits addressed included stabilizing, aligning, positioning, gripping, manipulating, and sequencing. The goal of my kit is to incorporate JW's left hand through a bilateral hand task that is meaningful to him. The occupation that I focus on for this task was sketching. The patient demonstrates using weight bearing through both hands to facilitate different steps in the kit, as well as implementing the left hand as much as possible to decrease left side neglect. In the activity, the patient has been demonstrating the concept of opening and closing the kit, being able to reach across midline to grip coloring utensils, and placing them in the designated containers. The patient will also demonstrate how he can draw on the kit to weight bear through his left hand and implement range of motion of wrist extension. The patient can then decide if he would like to keep drawing or place his sketches inside the kit to find at another time. There was significant evidence that supported the purpose of this kit. Research mentions that individuals with traumatic brain injury perform functional tasks better when the task implemented weight bearing through bimanual therapy. Another article found that the blend of unimanual and bimanual therapy improved motor function in individuals with traumatic brain injury. Lastly, a research article found that an increase in white matter of the corpus callosum occurred when bimanual therapy was included in therapy. At the beginning of this demonstration, the patient came across a difficulty when trying to open the containers with only his left hand. When creating this kit, I wanted to see if my fieldwork patient was able to open these containers using no modifications. However, I added in the strings just in case. After administering this to my fieldwork patient, JW attempted to open the containers without modification, but was unable to complete this within the current session. Another modification that I could incorporate is to increase or decrease the amount of coloring utensils he would have to transport from the white container to the blue containers and vice versa. With the patient seen in the video, I decided to administer fewer coloring utensils for the sake of time. With my fieldwork patient, we were able to complete 15 coloring pencils and 15 markers, a total of 30 items. This took almost 40 minutes to complete as the patient continuously described how he liked the challenge, how it connected to his personal values, and how much it took for him to transport each coloring utensil one at a time. A few contraindications would be if the patient had visual deficits or was unable to understand verbal direction. The OBK intervention is a skilled, justifiable service because occupational therapists can use this activity to administer multiple deficits, such as fine motor coordination, visual scanning, the inability to understand verbal direction, and range of motion. The kit provides OTs the ability to modify the task based on the client's performance and clinical reasoning within practice. I enjoyed creating this kit and being able to administer it on a patient through fieldwork. JW couldn't stop talking about how much he loved, how meaningful it was to him, and that he wants to be able to take it home with him. I can't wait to see what my peers have created for their patients. Thank you so much for watching, and if you have any questions, just let me know. Have a good day, guys.